As you assess the scene for safety, there are universal precautions you should take. These precautions are called universal because you should treat all blood and other body fluids as if they contain germs that can cause diseases. Your first aid kit may include personal protective equipment, or PPE, such as eye protection and non-latex gloves. While giving first aid, these help keep you safe from blood and body fluids, such as saliva and urine. First aid kits may also contain a mask or face shield for giving breaths in case you need to provide CPR. And because some people are allergic to latex or have developed sensitivity to latex that can cause serious reactions, you should use non-latex gloves if at all possible. You should always wear personal protective equipment whenever possible. However, if the child's blood does make contact with your skin or splashes in your eyes or mouth, take these steps. Remove your gloves if you are wearing them. Immediately wash your hands and rinse the contact area with soap and lots of water for 20 seconds. Rinse your eyes, nose, or inside of the mouth with plenty of water if body fluids splattered in any of these areas. And report to a healthcare provider as soon as possible. Because of the risk of infection, using protective gloves and taking them off correctly are important steps when it comes to your safety and the safety of others. Let's watch more closely how to remove protective gloves, and then you'll get a chance to practice. First, grip one glove on the outside near the cuff and peel it down until it comes off inside out. Cup it with your other gloved hand. Next, place 2 fingers of your bare hand inside the cuff of the glove that is still on your other hand. Peel that glove off so it comes off inside out with the first glove inside it. If blood or blood-containing material is on the gloves, dispose of the gloves properly. Put them in a biohazard waste bag. If you do not have a biohazard waste bag, put the gloves in a plastic bag that can be sealed before you dispose of it. Always dispose of protective gloves properly so that anyone else who comes into contact with the waste bag does not get exposed to blood or body fluids. You should always wash your hands after removing gloves just in case some blood or body fluids came in contact with your hands. We will cover hand washing in just a minute. Now, as we go through the course today, you're going to have a chance to practice skills that would require you to wear gloves. Instead of actually using gloves for every practice, just say out loud, "I'm putting on gloves," as you begin. This way you won't have to actually wear gloves every time. As we mentioned earlier, even if you've been wearing protective gloves, you should always wash your hands just in case some blood or body fluids came in contact with your hands and to prevent the spread of germs. To wash your hands properly, wet them with clean, running water, warm if available, and apply soap. Rub your hands together and scrub all over for at least 20 seconds. Then, rinse your hands with lots of running water. Dry your hands using a paper towel or air dryer. If possible, use your paper towel to turn off the faucet. If you can't wash your hands right away, use waterless hand sanitizer. Rub your hands together so the sanitizer covers the tops and bottoms of both hands and all fingers. Then, let the sanitizer air dry. Then, as soon as you can, wash your hands with soap and water. Washing your hands well is one of the most important protections you have against infection. And reminding children to wash their hands often is a good idea, even if there is no emergency. Now, it's your turn to practice taking off protective gloves correctly. The video will now pause so you can get ready. Your instructor will test your skills after you get a chance to practice.